Today we'll be speaking about the brachial plexus in easy way. Now we'll be writing the headings: roots, trunk, division, cords, and branches. Under root we'll be making 5 boxes and we'll name it as C5, C6, C7, C8 and T1. Okay. Now consider C5 and C6 as friends which like to go together, C8 and T1 as staff who like to go together, and C7 as principal who works alone. Now this completes your root. Now we'll be starting with the trunk. We'll be drawing a straight line and then we'll name it. C5 and C6 forms upper trunk, C7 forms middle trunk, C8 and T1 forms lower trunk. Next, division. As name suggests, we'll be dividing into two. One is anterior division, another becomes posterior division. So middle also divides into two, anterior and posterior. Lower again divides into two, posterior and anterior. Now we'll make a partition so that we don't get confused. Now starting with the chords, anterior division of upper trunk, anterior division of middle trunk will form a chord. So anterior division of upper trunk, anterior division of middle trunk will form a chord called as lateral chord. Next, posterior divisions of all the trunk will form a chord called as posterior chord. Next, anterior division of lower trunk will form a chord called as medial chord. We'll draw a partition. Now we'll make up branches in the form of Y. And we'll name it as Marmu, M-A-R-M-U. M stands for musculocutaneous nerve, A for axillary nerve, R for radial, M for median nerve, and U for ulnar nerve. This completes the brachial plexus. Next, there are other branches. So C5 will give a branch called as dorsal scapular nerve. C5 and C6 will give another branch called as nerve to subclavius. Next, C5, C6 will give a branch called as suprascapular nerve. C5, C6 and C7 will give a branch called as long thoracic nerve or nerve to serratus anterior. This was the branches of roots, trunk and divisions. There are no branches. Chords, lateral chord has 1 branch, posterior has 3 branches, medial chord has 3 branches. Lateral chord, 1 branch is called as lateral pectoral nerve. Posterior chord, First branch is upper subscapular nerve, lower subscapular nerve, and thoracodorsal nerve. Medial cord, medial pectoral nerve, medial brachial cutaneous nerve or medial cutaneous nerve of arm, medial antebrachial cutaneous nerve, which is also called as medial cutaneous nerve of forearm. So by this we have completed whole brachial plexus. Now to remember chords and its branches in easy way. Remember lateral cord, Lily loves me. L stands for lateral pectoral nerve. L stands for lateral root of median nerve. M stands for musculocutaneous nerve. Coming to the posterior cord, mnemonic is lunar. L stands for lower subscapular nerve. U stands for upper subscapular nerve. N for nerve to thoracodorsal. A for axillary nerve. R for radial nerve. Medial cord, M4U, that means there are 4 M. Medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve, and ulnar nerve. So by this we have completed brachial plexus and its branches.